Today we're going to talk about a herniated disc, and there are doctors out there who cannot wait to put steel in your back.
Oh, yeah, they're out there salivating like Pavlov's dogs for the opportunity to operate on you. So here's the reality of the situation. Number one, if you go to the mall, okay, and you ran MRIs on everybody walking around that did not complain of backache, neck pain, or shoulder pain, 1/3 of those individuals, 1/3 of those happy shoppers will have a herniated disc or two and be totally asymptomatic. Now, God help them, okay, if they lift something the wrong way, pull a muscle, jam a facet, and then experience pain, because the first thing that their well-meaning physician or chiropractor will do is order up an x-ray or MRI and then tell them, well, here's the obvious cause. You have a herniated disc. And that's when the fun begins, okay? And it's really kind of an unfortunate circumstance because it goes back to the basics of surgery. And one of the basics is you do not operate on a back for pain alone. And the answer is very simple. Just because you've got a herniated disc doesn't mean it's causing your symptoms. And in the case of those happy shoppers, it didn't, okay? A muscular pull. Pain in the knee can cause backache, kidney stone, gallbladder, pancreatic issues, peptic ulcer disease, hepatitis are all notorious for causing backache. And if you happen to be one of those happy shoppers that has a herniated disc anyway, and that now you're having pain from something else, you too can experience the Bard-Parker procedure, which is another way of saying you're going to get your back sliced open for little or no benefit to you. Well, here are the statistics. 1/3 of all persons, okay, that undergo laminectomy, fusion, or any other procedure, 1/3 get worse.
Ouch.
1/3 stay the same, and 1/3 might get some relief. Now, there might be a small slice to that pie where they get relief, but it's the smallest piece. It's hardly measurable. The fact of the matter is that no surgeon is ever going to promise you that it's going to make your pain go away. They will not do it. Okay, why? Because it's a matter of, let's just say, getting them into some trouble for making promises they cannot keep. Okay, it's called breach of contract, which it buys them a ticket to the board. The long and short of it is that the decision to make, the surgical decision is never made on pain alone. In order for you to qualify where I came from, and I came from a rather nice institution up in Durham, North Carolina, where we did not operate on folks for pain. We operated on them for loss of muscular function, bladder or bowel control. Then surgery made sense. And you certainly didn't operate on folks that were morbidly obese. You certainly didn't operate on folks that had bad systemic illnesses that tended to not recover well. And for a long time, and probably to this day, we did not operate on smokers because the outcomes for smokers in laminectomy was so poor. So here's the deal. Right here in sunny Florida, we have lots and lots and lots of surgical talent, okay, that's out there operating on people. And what does this do? It leaves them in pain, it cripples them, and leads them up to the inevitable surgery number 2, which then leads to surgery number 3 and sometimes surgery number 4. And I have a practice full of these victims, a practice full of patients that wish they had never gone for that first surgery. Well, how do you know that you need surgery to begin with? Just because you have a herniated disc. Why? Okay, because in order to know that any of these nerves are damaged at all, you need to test it. How do you test it? A nerve conduction velocity study, which can be done very painlessly. This is not a big deal, okay? And it will demonstrate the presence or absence of a nerve that's damaged in your back. And if this is the case, then maybe you are or will be a candidate for surgery, but you certainly don't do it straight out of the chute. What can you do? So you have a herniated disc here, you have a herniated disc there. Is it new? Is it old? Okay, when you look at these MRIs, you can tell whether or not something is a fresh injury. If it's an old injury, well, what was it that happened last week that set things off? Maybe it has nothing at all to do with the disc. Now, what is a herniated disc? Well, let's take a step backwards. What's a disc? Okay, it looks a little bit like a jelly donut, a small one albeit, but a small jelly donut with a firm, fibrous, we call it annular because it's shaped like a ring, binder to it. It's almost like a corset holding the goo on the inside. And when it ruptures, that fibrous corset breaks and the goo extrudes. So what do when you do a laminectomy? You go in there and you take out what's left of the disc and then fuse the two bones together. In theory, that sounds like a grand idea. But, that disc wasn't put there by accident. It wasn't put there for your misery. It was put there as an articulation. It's a joint, believe it or not, that allows the upper and the lower two vertebrae to move. They bend on each other. So when you go ahead and fuse this thing, whether it's with a piece of cadaver bone or a piece of steel, it leads to loss of mobility, and guess what? The body tries to make up for it in the immediately adjacent upper and or lower vertebra. They start to hyperextend, hyperflex, and now you have problem number 2 and 3. So when you do number 1, you can expect that you're going to get a boatload of number 2. In many poetic ways, this is going to be the case. So what do? So somebody told you that you have a herniated disc. Well, the first thing that I would do, and the first thing that I've done, and the first thing I did personally when I was told the same thing, was I went out and bought a $200 inversion table. Why would I do that? Because it's cheaper than going to the chiropractor. And you set the thing at 20 degrees head down, 20 minutes, and guess what? You use your weight to decompress the vertebra. You do this 2 or 3 times a day. After all, you bought the device. Okay, you have it now forever. And oddly enough, it starts to give relief very, very quickly. You don't do it like they show you on television when you hang upside down like a bat. That's nonsense. 20 degrees head down, 20 minutes, and you'll get relief within the first time or 2 that you do it. Why does this work? Because it starts to suck the disc back into where it belongs. It's called traction. Distraction, and what happens here is you start to get symptomatic relief. Anti-inflammatories orally are marvelous, very, very important. If you have an acutely herniated disc, bromelain is a marvelous approach to this because it's a proteolytic enzyme that actually starts to eat away at the extruded disc parts. Has to be taken on an empty stomach. We sell it in the office for about $16. This stuff is dirt cheap. Well, what else do? Okay, now that you're hanging upside down 2 or 3 times a day, you're taking your bromelain, you've got your anti-inflammatories. It's very, very beneficial to take what are called GABA agonists. Okay, my favorite one here is one called baclofen. You take it at bedtime. It deepens your plane of sleep. It tends to settle the nerves down that are causing the pain to begin with. And then to that, we add Lyrica. Now, gabapentin was one I used to use a lot of in the past. Does not work nearly as well as Lyrica, which does not seem to have these ceiling absorption issues that gabapentin does. Now, with the combination, you wait 2, 3, 4, up to 6, maybe 8 weeks, and things settle down. It's only then that you start making decisions that might be life-altering. So what do? Then you go ahead and you get a second and perhaps a third consult. You get lots of opinions here, okay? You can go out to the golf course and you'll get lots of opinions there also, okay? And they're all going to be contradictory and they're no more valuable than the ones you got from your doctor, actually. So what do? You sit down with your doc and you say, look, what are my options? And they always start with the ones that they want to do first. Why? Because they too have to pay for their grain fees, okay? So surgical opinion, but gee, doctor, if I were your kid, if I were your wife, or if you were sitting here, what would you do if this were your back? If you can ask that question and get an honest answer, and look at the doc straight in the face when this one's coming back at you, because if they look down to the left or up to the right, you know that you're not getting a proper answer. Okay, that's just not going to happen. So, or if they hesitate for a moment, well, whatever. Oh, you hear that? Okay, you're going to know that you're not going to get much of an honest answer because they're not treating you as if they were going to treat themselves or their family. And personally, the way I prefer to treat my patients as if they were my family, my friends, or myself.
All right, very good. Now, when you need nutraceuticals, when you need to see a doctor, maybe you need to see an esthetician because you see these Christmas pictures and you're going, boy, I sure look old. Well, you can look as good as you feel. It's all at the stages of life. And Robin, how do we connect?
Give us a call at 407-679-3337. Check us out on the web at stagesoflife.net. We're also on Facebook at Stages of Life Medical Institute. Our office hours are Monday through Thursday, 8 to 5, The health store is open during those office hours, and we're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434.